Watkunuradu and welcome to Kahnawake 911. Today we're going to launch what is going to be a daily update on the COVID-19 pandemic, and joining us today will be Lloyd Phillips, who's the Commissioner of Public Health in Kahnawake, and also Lisa Westaway, who is the Executive Director of the Kateri Memorial Hospital Centre. There's lots of news today, so we'll get right down to it and introduce Lloyd Phillips. Lloyd.
Thank you, Joe. Good evening, everybody. Just wanted to be as concise and as brief as possible on some significant developments that happened today. This morning, I was with Chief and Counsel, and a Mohawk Council Executive Directive, known as the MCED, was unanimously supported that officially enacted Emergency Operations Center, which is known as the Kahnawake COVID-19 Task Force, comprised of many healthcare experts and people from public safety and around the community. Namely, myself and Dr. Jones are co-chairs on this, along with Don Montour, Lazar, Valerie Daibo, and Lisa Westaway from KMHC, as well as Leslie Rice, who works also at Kateri Hospital and has a vast knowledge in communicable diseases. We have also Robin Montour and Ajeza Foot from Public Safety, Dwayne Zachary, Peacekeepers, David Scott, Derek Montour from KSCS, Roseanne Norton from MCK Human Resources. We also have a representative from MCK Communications that will be working very closely with us. We also have a vast array of experts that we could draw upon in the community and outside the community to help guide us through this tough time in which our community is facing. It's facing our community, it's facing the entire region, and for the most part around the world. One significant development today was a unanimous passage of a community-wide policy for all people who work for the community that would ensure that if they are contract the virus or if they are forced to self-isolate themselves, that they will not be stuck in a situation where they will be left without pay, or they won't be left in a situation where they have to use up all their sick or wellness days in order to ensure that they take care of themselves properly. So we did have a policy in place that would grant those extra days as required to all the people who are working for the community who are at risk and may need to self-isolate. It's a very flexible policy. It's a starting point. It's a unanimous point for all organizations moving forward. And I think it's important because from day one, we want to ensure that we're having a unified approach to what we are doing here. And again, it's all in the name of ensuring our employees are comfortable, our employees feel like we are caring for their health and their safety, which we certainly are. And this is an extra measure because we know many of them are on the front line and maybe more susceptible to being self-isolated or contracting the virus because they do work very closely with the public. So that was, again, a unanimous decision, and it will, they're all well aware of it, and it will be something that the employers, the supervisors will be speaking directly with the staff, and if there's issues that arise, they also have the flexibility in there to deal with stuff on a case-by-case basis. One of the major developments today, after today's first official meeting of the Emergency Operations Center, that it will be directed that all community organizations immediately start a plan to move towards providing essential services only. This is something that will stem the spread of the virus and ensure public safety is upheld and the safety of our employees is protected to the most possible extent. Plans are to start developed immediately, implemented as soon as possible, and we also want to ensure that the community is aware that we're going to also make sure the essential services and the basic needs of the community are upheld and are maintained so that you are not inconvenienced in any way. So with that, at this point, I will turn to representative from Kateri Memorial Hospital Center, Executive Director Lisa Westaway, to give you some more information on some of the changes happening in and around Kateri Hospital and in the community. Thank you.
Hi, so I'd like to bring you just up to date, as Lloyd mentioned, with some of the changes at Kateri Memorial Hospital Center over the last day or so. As you know, things change on a daily basis. So as of this weekend, as of Saturday, we have closed inpatient to visitors. Therefore, no visitors are allowed to come into the building to visit the elders. We ask that you trust our staff, our capable staff, to take care of your loved ones. We have also closed the Elders Lodge and ALS to visitors, and this is to protect the vulnerable population that live in these areas. For outpatient care, for the outpatient clinic, basically outpatient services will no longer accept anyone in the building who does not have an appointment. So for anybody who has an appointment in outpatient clinic, you will be contacted and it will be assessed whether you actually need to come in or whether you can be seen or assessed over the telephone. So there will nobody will be allowed in the building who does not have an appointment in outpatient clinic. We are also no longer accepting walk-ins at any point. So I'm saying the same thing in two different ways, but for our walk-in clinics, so when I say our Saturday clinics or our evening clinics, they still will be available by appointment only. It was always that way, but the community sometimes did try to walk in. Nobody will be allowed in the building that doesn't have an appointment. The dental is closed. The optometrist is closed. There will be no appointments. Foot care is also closed. For any blood work that is required, we ask that you contact Kateri Memorial Hospital Center at extension 2304 in order to get an appointment for your blood work. So those are the major changes that are happening at Kateri Memorial Hospital Center. Again, in an effort to limit and slow down the transmission of the virus across the community, but ultimately in an effort to save lives. So we're really making an effort to close as many services as possible while maintaining the services that are required. The next thing that we wanted to mention, we also put out a public service announcement yesterday advising all people over 70 years old, and this is just for the community at large. We really want people who are over 70 to stay home as much as possible. Have your family members take care of you, do your groceries, try to stay home as much as possible, not be in any social areas. We do also recommend that people who are immunosuppressed stay home. And so if I talk more specifically about employees over 70, it's not all employees that will be required to stay home and not work. Some employees over 70 will be able to work, and so we would ask that you check with your employer to assess each situation accordingly to make that decision. However, if you are immunosuppressed, and I have some examples to give because we've seen a lot of questions on the Facebook sites about what that means. So what that means is people on anti-rejection medications such as Prograf, Cellcept, or Imuran. People who are on medications for overactive immune systems like Remicade or Humira, and children who were born with immunodeficiencies. Those are some examples of people who are immunodeficient and who should not be working and who should be staying home and isolating themselves from large groups or from people. They should just be comfortable in their homes as much as possible. If you're not sure if you are immunosuppressed, then you could please check with your physician for that information. We, in an effort to try to put all of our information about COVID-19 in one place, this evening there will be a website that will be launched. It's at covid-19.kmhc.ca. So all you have to do is go to the KMHC website, and there'll be a link that will take you directly to the COVID-19 subsection, and that will be the hub for the community. So all information about COVID-19, whether it be new releases, whether it just be general information, whether it be news bulletins, it could also be links to other sites that we urge you to look at, as opposed to just following Facebook, but going to specifically recommended sites. All of that you'll be able to find at the covid19.kmhc.ca, and you'll be able to sign up for notifications so that you're well aware when we post new elements to the website. Again, all of these measures are being implemented in an effort to try to save lives. So we really urge you to communicate this information to people who may not have the opportunity to see it or hear it, and really try to protect our elders and those with immunosuppression, so that they stay home and that they're well taken care of. So we're counting on the community as a whole. This is not about us as individuals, it's about us as a collective, and we urge you all to work together to try to get through this together. There's one last thing, sorry, that I forgot to mention, is about the iron workers, and it's a question that has come up quite often. And we know that we have our iron workers that are going back and forth from New York to here. We were expecting Trudeau to close the borders today. He didn't close the borders to residents. However, considering the number of cases in New York, we highly urge our iron workers to either stay in New York or stay in Kahnawake to make a decision about where they would want to stay in order to reduce the possibilities of transmission of the virus. We know it's not easy. We know it's a difficult choice, a difficult decision to make, but it's a recommendation that we're making. And we would ask that when the iron workers do come to Kahnawake, that they do self-isolate for the 14-day period that we're requiring of anybody who's come back from travel after the 12th of March. So I thank you, and I'm going to pass to Lloyd to do a final statement. Okay, thanks.
Okay, thank you, Lisa. And just again, to underscore the importance of the message that we're trying to deliver here, and we've been delivering for the past week. What we're doing here is we're trying to save lives. Some people may think the measures that we are taking are extreme, and honestly, some people think they're not extreme enough. But we are doing it based on medical information, based on advice from our local authorities, as well as regional, national, and international information. So we're doing what we feel is appropriate, and there will be additional measures that will be required. But we are here today just to update you where we're at. I want to mention one thing, and I don't know if people were seeing me on the radio, heard me on the radio this morning, but what you hear on the news is about the people who unfortunately contracted the disease and died. You're hearing a lot of numbers out there. For example, in Italy, they're saying 1,800 people in the country of Italy died from the coronavirus. But what you're not hearing as well is how many people who died indirectly from the virus, because all the ICU beds, the intensive care unit beds, were full of people needing advanced care because they had the disease. And now you have individuals who have a heart attack or have other medical conditions, have accidents, who require advanced care, who require an intensive care unit bed, and they're not available. And so there are fatalities along those lines as well, but that's not being reported. We need to be very mindful of that, because if all the beds in our region are taken by people with coronavirus, and then we don't want to have the situation like what's happening in Italy and France, where people who are having heart conditions and such do not have the beds available to properly treat them. So it is a major worldwide crisis, and unfortunately, all the experts, and even listening to the press conference held by the Ministry of Health in Quebec yesterday, things are likely to get worse before they get better. So we have to be prepared, we have to be vigilant, we have to make decisions according to the latest scientific evidence, and like Lisa mentioned, we have to take care of ourselves, and we have to take care of our elders and those who are most vulnerable. We will, get through this. Community spirit is alive and well. We heard it from many sectors in the community today, including the business sector, and we'll be looking to have that spirit continue as we move through a difficult time for our community. And also, in an effort to keep community informed, we will be doing daily briefings. We're going to be trying for around 4 o'clock every day to have a briefing to give you the latest information that's available regionally and nationally, but more importantly, what's happening here directly in our community. So with that, thank you very much, and we'll see you soon.
All right, Nyawa Lloyd and Nyawa Lisa, and Nyawa go to you guys for watching today. As Lloyd stated, there will be a briefing every day, most days anyway, at around the same time, also including the weekends. So just pay attention. Once again, Kahnawake 911 on Facebook, and at the Kateri Memorial Hospital Center, the COVID-19.kmhc.ca. And with that, take care of yourselves, take care of each other, and we'll see you next time. Nyawa Goa.